Now it is my pleasure to introduce Dr. Peter Gasser. Dr. Gasser is a physician specialized in psychiatry and psychotherapy, working in private practice in his home country, Switzerland. He was trained in psychodynamic therapy and therapy with mind-altering drugs. He's a member of the Swiss Medical Society for Psycholytic Therapy since 1992 and has been its president since 1996. Between 2008 and 2012, he conducted a randomized control trial of LSD in the treatment of psychological distress associated with life-threatening diseases, such as cancer. This study showed very promising results, and since 2017, he has been conducting a second study investigating the same research questions. Dr. Gasser holds a number of individual permissions from the Swiss government to practice augmented psychotherapy with LSD and with MDMA. And because he's certainly one of the most experienced practitioners of psychedelic and psycholytic therapy in the world, we are very happy to have him on board as one of our clinical supervisors in the German episode trial investigating psilocybin for treatment-resistant depression in Mannheim and Berlin. Today we'll speak about one of the most exciting topics, in my opinion, for the coming years, and that's psychedelic group therapy. Ladies and gentlemen, give a warm welcome to Dr. Peter Gasser.
Ladies and gentlemen, dear colleagues, it's a pleasure to present here, and I thank very much for the invitation of mine to come here, especially from Andrea and Henrik. And I hope that I can bring you some useful information about the psychedelic group therapy that we have done and still are doing in Switzerland. Just to my person, as it has been said, I'm the president of the Swiss Medical Society for Psycholytic Therapy, and I have 2 counseling agreements with Compass Pathways and with MindMed. Yes, let's just start and dive into the topic. And if we now as a group were in a psychedelic workshop, it would be 5:30 p.m. and that would mean if you had taken LSD that it is going towards the end, the plateau phase or the peak experience is over and you come slowly like on a sailplane back to normal, back to your personality. And at that phase of the experience, a friend of mine in workshops, he played a thing he called integration music. This was a kind of loud and rough music, and he advised the people just to feel or to imagine that they are a hollow tube, and the music comes in and goes out, and you don't have or don't feel any resistance to that music, nor attachment. It's just like going through and being still in this state of openness and of being mindful to everything that appears. I recommend you to listen to my presentation in this mind state, and I hope that at the end of the presentation you will be fresh and ready to go out for having dinner. I don't want to bore you, but just giving a few information that gathering in groups for healing purposes is nothing new at all. It happens since thousands of years in shamanic or neo-shamanic nowadays rituals. People were gathering just to meet, to get healing in a group setting or to bring in order conflicts or problems. Some 100 years ago, it started also with more religious gathering, taking ayahuasca, this Santo Daime or União de Vegetal circles who take psychedelic substances for spiritual reasons for this communion. Even if you have seen the film before of this meditation retreat group that was shown, there was a Buddhist meditation group and they could take psilocybin during their meditation practice, but this is still an exception. And without substances, it started in the first half of the 20th century that people like Moreno or some psychoanalysts developed a therapy model that took place in a group, solving individual problems in a group context, sometimes with bringing the problems from outside in, and the group helps to solve it. Or there is some mutual conflicts or problems between group members, and the group is the place to help and to treat this. This picture is from this film Yalom's Cure, and Irving Yalom, the man on the right side, he developed group therapy for a long time. He had written a comprehensive textbook also about this. I can recommend you the film that has been made about him for those who are interested in psychotherapy. It's a touching film. There was also psychedelic underground group therapy after the ban of the psychedelics. Leo Seff, an American psychiatrist who after the 1970s brought together a large number of therapists and gave them the opportunity to do group sessions, and his work is described in the book The Secret Chief. On the right-hand side you see Friederike Meckel-Fischer. She is a medical doctor from Switzerland. She was sued by the wife of a patient of hers, and then she was sentenced to a fine, but then she was there was no more underground. That was known that she did that work, and then she wrote that book, The Therapeutic Substance, where she precisely describes the way she did group therapy. But today we want to talk about this kind of group therapy. This is our group therapy room outside the practice. You see my wife Anke there sitting on the floor. We are doing now this work together. She's also a psychotherapist. And before I did it with Peter Owen and another therapist together, but Peter retired, and now we do that together. You see the patients lying on their mat. Some are sitting, some are lying in their individual process. And that's the way it looks the most part of the day. Just people being more or less silent on their place and drawing the attention inwards, although they have no eye shades or headphones. They listen to the music from the loudspeakers. The next day we have the integration round, and then we're sitting in the round. Everyone is talking about their experiences, and they are getting feedback from each other. Yeah, let's talk a little bit more therapeutically about psychedelic group therapy. This is an excerpt of a personal report that a man has written. Although I dealt with being open to everything that would occur to me, and I tried not to have any expectations, I was quite afraid when entering the room. There were far too many people, and they all seemed to know each other. Only I didn't know anybody. I felt excluded and somehow wrong here. I had pictures of religious sects whose members always seemed to be suspiciously nice and cheerful. I really felt bad, and I decided that this would be the last weekend. This is a quite common fear that people express when I address to them that they could do group therapy or psychedelic group therapy, both. A kind of anxiety that you come and don't know. It is a hard thing to go in therapy, and it's a hard thing to express your intimate feelings and your problems before one person, the therapist. It's even more harder to express this in a group. And so people say, why should I go in a group when I have enough problems to tell it to you? And the other thing is that people say, I have enough problems myself. Why should I listen to the problems of others? That is a burden that is too heavy. So this is the common, I would say, the common two prejudices people express when they are invited to come to group therapy. But the report of that person, which is a colleague of mine still today, this report is dated from November '89, when the SÄPT conducted therapist training started. This was the first weekend we met, and at that time it was legal in Switzerland to have LSD and MDMA under special circumstances. So we had an MDMA session for the first group weekend, and the report is continuing. It is difficult to describe the next day because it was an undescribable experience. Suddenly there were no limits, not inside nor outside. There was no more inner chat, no self-controlling ego. There was pure being. I felt the floating calmness within myself and the connectedness with every single person and together as a whole in that room. So it is, a typical first MDMA experience, and also to see that he really connected to the group, and for him there was no question if he would continue or not. Of course he continued and is still a member in our society. Yeah, what are the pros and the cons for psychedelic group therapy as far as I experienced them? One is certainly learning for peers and connecting with peers. So this is one of the main factors also described in Yalam's book. It is a thing that is called the group energy, and if you have seen the film before, there was a kind of discussion if what the placebo people experienced, and of course they had a really strong experience too when the other has the psilocybin. So the group is building up an energy that is different from a single treatment. Then there is a common level of reality, which even if people go far away in different states of consciousness, it is always clear that there is also the reality of being in that room together with other people, and they looking at you, you look at them, so that there remains stable in some way this level of reality that can hold you. Then after it is important, and also an important factor is a safe place to meet real people in an altered state of consciousness, and you can exchange your experiences with them because they are knowing what you are talking on. People often say, when I go out now, I talk to people, they don't know at all what I'm talking of. That's not the case in the group. And then we could have a long discussion, there is also an economic advantage, which is at the moment also of some importance. I think it's not the most important thing. I think it's more important to provide best treatment possible, but the economic factor, of course, is of some importance. Yes, what are the cons? One of the difficult things is that people have prejudice. They say, yeah, what I said before, these two things, or it's chaotic or burdening. There is a question also, what about people who have social anxiety? Should they be included or excluded from groups? I would say in general they should be included. It is a good experience for them to be really confronted with a real group that is supporting, that helps you. So I cannot remember for having problems with someone who had social anxiety. Of course, for more vulnerable individuals, it can be too complex and too difficult to attend a group. Like I have a patient with autism spectrum disorder, Asperger's. This person is really overloaded with so many people. He could not come to the group. That is clear. I have a blind patient in therapy with LSD, and for her it's the same. I mean, she would not have enough orientation in this group situation, coming noise from everywhere. So for her, a group therapy is not appropriate, I think. Also, end-stage cancer patients, sometimes they are really physically weak, and for them it's too difficult and too exhausting to be in a group. But beside of them, I think with some motivation for most of the people, I thought that group therapy was, I think, a good setting to make the therapy. But really, there is less individual answering of needs. I mean, having a therapy as an individual, on the left-hand side you have a female therapist, on the right-hand side you have a male therapist, and they are here for hours with you. I mean, this is the maximum comfort, the maximum support you can have for a treatment. And here, I mean, it's Anke and me for 8 people, so there is less time for each person, that's obvious. There is a systematic review published in 2019 by Trope and collaborators. They systematically reviewed the literature. They found 12 publications with psychedelic group therapy between 1959 and 95, 6 with LSD, 1 with MDMA, 6 unknown. That means 1 is mixed MDMA and LSD. 9 were open label, 1 controlled randomized trial. I didn't know about this. 1 semi-blinded and 1 post-therapy survey. And this survey I have done by myself with the patients that underwent group therapy in Switzerland from 1988 to 93. It was 171 patients. I wrote them a letter with a questionnaire, 121 answered. And just in short, I mean, the quality of this post-therapy survey, I have to say the methodological or scientific quality is not too high because it is post-therapy, it's a mixed group, it's no control, but it's only for giving you an impression what people say after the treatment. And you see here, self-perception and social behavior. There's the vast majority who said that they improved for different aspects, self-acceptance, autonomy, quality of life, relationship to family, or commitment at work. So a lot of people say, yes, I have some benefit from this treatment. Also, when asked about the experience, the psycholytic sessions, unfortunately the pointer doesn't work, but the second from the left, relationship to others, you see is the second most important after emotional experience. So the relationship to others in the group seems to be of high importance for these patients that when they enter the group and feel the support of the others. And this is also just interesting, even in a group you can have spiritual experiences, so it's not all about relationship and these kind of topics. So if asked if their access to the divine have improved or the fear of death has diminished, is also a big majority who says yes, it is like that. Now let's go into another area. After 2014 in Switzerland, it became possible to get permission for doing psychedelics-assisted therapy in individual cases. It's therapy, it's not a research project. So we can, if we get the permission, the approval, take these patients and give them LSD or MDMA, or since this year also psilocybin for this. Some call it compassionate use. I go a bit away from this expression because it comes from oncology. I'd like to call it psychedelics assisted therapy, or as it is called by the administration, restricted medical use. And the Swiss law on narcotic drugs, in the film before, it was said psychedelics were banned in the 1970s in most of the countries of the world except Switzerland. This is wrong. We have the same laws as you have in Germany or in the UK or in the United States. In Switzerland also all these substances are the highest listed narcotics with no therapeutic or scientific value, it is said. But there is an article number 8, and in the passage 5, it is said what exceptions can be made. And they say, it is in German, there can be made exceptions from the prohibition if it serves for this restricted medical use, so to give it to patients. And it's not defined what it is meant by that. So there is some Spielraum? Huh? Leeway? Okay, that means the administration can decide on their own estimation if they will give this approval or not. And we profit at the moment from that because the administration is quite open to our work. And it's only the health administration, so the Federal Office for Public Health, who gives the permission. There is no other approval necessary, no ethics committee. The drug regulation agency does not have to give a permission also. It is given to medical doctors who have a basic knowledge for psychedelic-assisted therapy. And actually we can do it with LSD, MDMA and psilocybin because we can have a collaboration with Professor Liechti at the University in Basel. He provides us with the substances, and I mean, that is the other bottleneck. If Professor Liechti has no substances, there is no compassionate use or restricted medical use in Switzerland, even if you have a permission. You don't have the substance. They give, that's interesting, the application for individual cases for therapy based on the psychotherapeutic process and not based on the diagnosis. That means we don't have to show that there is a scientific evidence or research that has been made, for instance, for obsessive compulsive disorder. There is not so many data. We can do it just the way if we can show we do a psychotherapeutic process with them. We have to report every year, but then a prolongation is possible depending on the therapeutic process. In Switzerland, after 2016, we make this group therapy. We include patients who have the permission for PAT, able and willing to participate in the group. We are at least two therapists. The group size was until now 3 to 13. The group is mixed in sex, age, diagnosis, also in language. It's not so easy as English-speaking people having on board. And it's also mixed in substances, is LSD and MDMA. We have both in the same group. The structure is continuous, open. You can come or leave the group anytime, and the maximum is 4 times a year. We have a 3 days workshop. I will show you the structure soon. And we have this meditative music and silence and interactive setting. This is a terrible slide. I know it's far too much information on it. It shows the patients I have now in treatment since 2014. And the yellow show which ones were in group therapy or are still. The blue, with the year of birth, you show the oldest and the youngest from 39 to 90, 1939 to 1990. 12 sessions, the one who has the most, 0 session, 1 woman, she attended without taking substance, only attended the workshop. And we also have the possibility to start, for instance, with MDMA and then switch over to LSD, so that some people had 8 sessions with MDMA and 8 with LSD. Jasmin Schmid from the Liechti Research Group in Basel, oh, it's only 3 minutes, I have to hurry a little bit. She was comparing what our group patients experience acutely when they take MDMA compared to healthy volunteers, which they had in their Basel studies. And you see the overall altered states of consciousness scoring is not so really different. And what is different is the anxiety, anxious ego dissolution scorings are higher in the patients group. That is not a surprise. Patients often suffer from anxiety. What visual restructuration here means in MDMA, I have no explanation for this finding. Maybe you have an idea about this. The same for LSD. Here is also, you see the 200 micrograms group has a higher maximum of the overall altered states of consciousness, and the patients group and the 100 microgram healthy volunteers is about the same. There is a significant difference for the high LSD group in visual phenomena. Oceanic boundlessness is the same 100 micrograms and the patient group, and anxious ego dissolution is quite near beside every 3. So let's talk a little bit about therapy. And Rick Doblin, he is also here, said it's not the drug, it's the therapy enhanced by the drug. And you see this beautiful office he has in his house in Boston, and it's not arranged, it's the way it is. You know about these treatment principles. Setting substance is known, I think, almost for everybody. But there are other triads also. This is also a triad. We have a preparation phase, we have the guided experience, we have the integration. And I have to say this therapy is embedded in an ongoing conventional psychotherapy. So we have the group members in a psychotherapy process, and from time to time they come to a workshop for experiencing the psychedelic drugs. I think I have to go quite quickly. This is the structure of our workshop. You see the program, what we do. Day one, we meet in the evening, about from 7:30 to 10 o'clock, and then we do a kind of getting to know each other, sharing, having preparation exercises, mindfulness or breathing or whatever. And on day two, that is the day of the substance, the intake of the substance about at 10 o'clock normally. And then we go through with music and silence, short breaks, careful interaction between the therapists and the patients. But also among the patients, we recommend them in the first half not to go to other people and say, is it okay to come to you and I feel lonely, can I come and share with you? Only, I would say, in the last third of the time, we encourage a little bit this kind of contact. Then the third day, very important for everyone, also for us as therapists, the sharing in the group, where we get to know what happened the day before. And then patients give feedback, and this is one of the integration steps for integrating the whole experience into everyday life. Then the same thing as what is the process of the whole. Unfortunately, I think there is not enough time to go here into detail. The preparation is a kind of building a trustful relationship, and always for new people coming, maybe they are scared, and we share our empathy and witnessing with them. We show our expertise in answering questions so that at the end everyone can say, now it's okay, I can start tomorrow. Then comes the guided experience, and finally the integration. I have written an article in this book that Katrin Preller and Frederick Barrett are editors. I wanted to say something about the word disruptive, which I don't like, but no, time is too short. I will do it another time. And this book will appear soon. I think it's almost ready to appear on the market. That is what you should or could take home from my presentation. Psychedelic group therapy is not new. It can be safe, effective, and cost-effective treatment. It has advantages for patients who are suitable for that treatment. And the last picture is an MDMA workshop. Last weekend, we met in our Swiss Psychedelic Society on a mountain area in Switzerland, and on Sunday morning we did a walk, and these pigs were lying around there, outside there, and it was so peaceful. They sleeping and just lying together, giving warmth to the other individual, and it was really, I think, pigs are not so different in that sense from us. Also, we like the warmth and the closeness of other people, and that is what often people experience, especially when they do MDMA in groups. Thank you very much.
Questions from the online audience?
I have to say something to the questions. I have a tinnitus and I'm a 60-year-old man. Sometimes I don't really understand what you say. So please speak loud, slowly and up, then I will understand.
Hello, thanks for the talk. We have a lot of questions from the online assistants. One from Daniel Gomes is what are the practical implications for phenomena such as transference and countertransference in psychedelic group therapy? This process seems to be massively activated during psychedelic sessions, but theoretical elaborations are rarely mentioned.
Yes, I mean, the concept of transference and countertransference comes from psychoanalytic treatment, and psychoanalytic treatment has no more that importance in psychotherapy and in psychology as it had before. But the phenomena of transference and countertransference still exists, even if you call it in another way. That means you will have strong reactions from the patients to you, to me as a therapist. Normally they are entirely positive, but they are strong and they arise quickly. This is different to a normal therapy where this is evolving slowly and slowly. And I think this, you have to count on that. That will be a strong reaction as you as a person. And I mean, in a way, it is normal. There is so much attention in this all intensity, and people then say, oh, this music was so fantastic. I mean, you played the right thing at the right time. Sometimes they tell also other things. But if they say this, it is not because my music or my intuition is so fantastic. It is part of the process. So we have to accept the strong transference as a welcome help for the therapy, but we don't have to believe it to be the truth. It is something you have to process. With the countertransference, which is even more, is even less said about, I think we have to clarify in the preparation phase if we really have enough trust for that patient. And it was in my slide, I went over it, but if we cannot really say yes to that patient for psychedelic assisted therapy, we should not do it. Not in group and not in individual therapy, because I think if you work with someone you are not really at ease for some reason, then that will maybe show up and then you cannot clarify it during the session.
We have one more question from the online audience and then we go into the room.
Frederick asked, which psychodynamic elements do you use for the psychedelic therapy, if you use at all?
Which psychodynamic elements? What are psychodynamic elements? I don't know. I cannot answer these questions. I can say I have a training in analytic psychotherapy, but it is 30 years ago, and I'm like most of the elderly therapists have a kind of mixture of much things, so I'm not always relying on psychoanalytic concepts in my treatment. I have to say that, although I understand the theory fairly well, but it is not always relying on that.
Questions from the room? Mm-hmm. Yes, please, the gentleman with the spectacles.
Hi, thank you for the talk. I was wondering, how do you decide on LSD versus MDMA and which substance to use?
Where is the person? Ah, yes, I see you. Okay, I understood. Thank you. I didn't see you. I understood. Yes. As a general rule, and as we have the possibility in Switzerland to switch from one substance to the other, I would say it's easier to start with MDMA for both, for the therapist and for the patient. So to someone who had never had a psychedelic experience before, this is more it's a smoother process, and I think maybe that has an importance. When we took also from the study that we are doing with LSD, then people into therapy. Then we continue with LSD just at the beginning because they had 2 LSD experiences before. What we cannot do in Switzerland, we cannot mix this candy flip combination. That can we not do? We have permission or for MDMA or for LSD. But I think on the free decision, in more than half of the cases, I would decide to start with MDMA and maybe to continue with LSD. As I said, with psilocybin, I have not so much experience because it was not available until now. But I think psilocybin and LSD are, from the experience, not so far away from each other, although psilocybin has a shorter time of action.
One last question from the audience. Yes, please.
Thank you, Peter, for your excellent presentation, taking a lot of stigma out of group therapy, group psychedelic therapy. I really like the fact that you said that you have to have trust of treating this patient with psychedelic therapy. But would you say that that would go for normal therapy as well? So would there be a patient that you would be able and willing to do the therapy, but not the psychedelic therapy? Or it's just a question of not wanting or being able to do the therapy with this particular patient, and then in extendence, not wanting to have this in a psychedelic therapy either?
Yes, under normal circumstances, I would say I would take every patient into conventional therapy, and we would do a piece of work together, let's say for 6 months or 4 months or whatever, and in this time I would evaluate if this maybe could be of help for that patient, and then I would suggest, and maybe he says yes or no. If he or she would say no, that's fine with me. I can do conventional therapy as well. Now it's a bit difficult, or another situation. I have so many people requiring this psychedelic therapy. I mean, I have to say no to 99% of all people coming to me, and this is a sad situation, I know. And for that, I have much more people who want to come, especially for psychedelics-assisted therapy. They come with that wish into therapy. So this is no more that way that I would do a longer piece of psychotherapy first and then introduce it by myself. They introduce it by themselves.
Thank you, Peter Gasser. Applause.